What do you mean by cold sterilization? A. Sterilization under the temperature below 80. B. Disinfection using disinfectant. C. Sterilization under minus temperature. D. All of the above. And the correct answer is B. Disinfection using disinfectant. Disinfection using disinfectant is known as cold sterilization. Which of the ECG findings indicate the presence of hypokalemia? A. Tall peak T wave. B. ST segment depression. C. Widening of QRS complex. D. Prolonged PR interval. And the correct answer is B. ST segment depression. ST segment depression and abnormal U wave are the characteristics of hypokalemia. Sputum sample for AFB should be collected. A. Morning after wake up. B. After breakfast. C. In the evening. D. Whenever the patient cough. And the correct answer is A. After morning wake up. Early morning sputum is ideal for AFB test. Cough reflex is usually suppressed at night. Thus, the first early morning sample represents the overnight secretions accumulated in the chest. During infection, which among the following value will be elevated? A. HB. B. WBC. C. Platelets. D. ESR. And the correct answer is B. WBC. WBCs are responsible for fighting against infection, so this value will be elevated first. Nurse fails to administer correct medication to the patient. This action is known as A. Negligence. B. Crime. C. Tort. D. Betray. And the correct answer is A. Negligence. Negligence is the type of malpractice. It refers to doing of something which a careful and responsible person would not do. An intentional touching of a patient's body without consent is termed A. Negligence. B. Assault. C. Betray. D. Malpractice. And the correct answer is C. Betray. Purposely touching or applying force on patient's body without his consent with the intention to harm the person is known as betray. Frequent swallowing in a patient following tonsillectomy indicates A. Hemorrhage. B. Active gag reflex. C. Thrust in patient. D. None of the above. And the correct answer is A. Hemorrhage. Frequent swallowing in the patient following tonsillectomy suggests hemorrhage in the patient's throat. Aneurysm affect which layer of the artery? A. Tunica intima. B. Tunica media. C. Tunica adventia. D. All of the above. And the correct answer is B. Tunica media. Muscular layer of artery, that is tunica media, is most commonly affected by aneurysm. Low blood pressure happens when person stands up from sitting or lying position is known as A. Postural hypotension. B. Orthostatic hypotension. C. Supine hypotension. D. Both A and B. And the correct answer is D. Both A and B. Orthostatic hypotension is also called postural hypotension. It is condition of low blood pressure that happens when person stands up from sitting or lying down. Chest tube drainage is useful in which of the following conditions? A. Pneumothorax. B. Pleural effusion. C. Hemothorax. D. All of the above. And the correct answer is D. All of the above. A chest tube is a flexible plastic tube that is inserted through the chest wall and into the pleural space. It is used to remove air in case of pneumothorax, or to remove fluid in case of pleural effusion, and to remove blood in case of hemothorax. The appropriate time duration to assess the pulse is A. 15 seconds, B. 30 seconds, C. 45 seconds, D. 1 minute. And the correct answer is D. 1 minute. Continuous checking pulse for a full 60 seconds will provide most accurate result.